About 1 in 8 U.S. women will develop invasive breast cancer over the course of her lifetime. And when it comes to breast cancer, it's extremely important to distinguish facts from fiction. As part of Breast Cancer Awareness Month, ABC-7 medical contributor Dr. Neha Sharma, the medical director of the Hospitals of Providence and Northeast and Horizon City, joins me now with the real deal behind some of those myths. Dr. Sharma, let's start with one of the most common myths. Only women with a family history of breast cancer are at risk.
So, family history is definitely a risk factor for breast cancer, but not having a family history does not eliminate the chances of you developing breast cancer. If a first degree relative has a history of breast cancer, your risk of developing the cancer approximately doubles. Having two first degree relatives with the disease increases your risk even more. In reality, though, only 5 to 10% of breast cancers are thought to be hereditary. The other 90% are largely due to lifestyle and environmental factors.
Okay, next myth. Wearing an underwire bra or deodorant increases your risk of getting breast cancer.
That's false. There is no scientific evidence that supports that claim.
Okay, myth number 3. Only women are affected by breast cancer.
Although rare, breast cancer can also occur in men. According to the CDC, about 1 out of every 100 breast cancers diagnosed in the US is found in a man. Symptoms of breast cancer in men are similar to those in women. The most common symptom is a lump on the chest. Unlike women, men tend to delay going to the doctor until they have more severe symptoms like bleeding from the nipple. This unfortunately leads to delayed diagnosis, treatment, and higher mortality rates.
All right, Dr. Sharma, let's go to myth number 4. You do not need a mammogram if you're healthy.
That's also false. All women should follow the screening guidelines regardless of your health status. Preventive efforts are key to early diagnosis. The most recent guidelines suggest that women at average risk of breast cancer should be offered screening mammography at age 40. The decision-making process about screening, however, should be shared between the patient and the healthcare provider.
All right, let's turn to myth number 5. There is nothing you can do to lower the risk of breast cancer.
As mentioned above, about 90% of breast cancers are largely due to environmental and lifestyle factors. To keep your risk as low as possible, maintain a healthy weight, engage in regular exercise, limit your amount of alcohol intake, and also limit postmenopausal hormone therapy.
And we have time to dispel one more myth, doctor. The first sign of breast cancer is always a lump.
A lump is one of the most common symptoms, but not all breast cancers present with a lump. Other symptoms to look out for are changes in size, shape, or skin texture, redness or a rash, pain or swelling around the breast. And it's very important to look at and examine your breast regularly so you know what your baseline is. And if there are any changes that you notice, please report to your doctor right away.
And as always, doctor, early detection is key. ABC-7 medical contributor Dr. Neha Sharma, thanks.
Thank you.